Good afternoon, everyone. Thank you for joining us for our webinar today. Our webinar today is on the American Dream Employment Network, an innovative program that is making a real economic impact for persons with disabilities. My name is Michael Rausch, and I'm the director of the Real Economic Impact Network at the National Disability Institute. Before we get started on our housekeeping tips, we would like to give a specific shout out to our veterans and appreciate their service to our country, specifically today on this Veterans Day. So we greatly appreciate their dedication to our country. Before we get started with our webinar today, I would like to turn it over to my colleague, Nakia Matthews, who will give us some housekeeping tips. Nakia?
Thank you, Michael, and good afternoon, everyone. The audio for today's webinar is being broadcast through your computer. Please make sure that your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel. And if you accidentally close this panel, you can reopen it by going to the Communicate menu at the top of your screen and choosing Join Audio Broadcast. If you do not have sound capabilities on your phone, if you do not have sound capabilities on your computer, or you prefer to listen by phone, you can dial the toll or toll-free number you see here and enter the meeting code. Please note that you do not need to enter an attendee ID. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right-hand corner of the webinar platform. If you do not see the captions, you may need to open the Media Viewer panel by selecting the Media Viewer button in the upper right-hand corner of the webinar. If you would like to make the Media Viewer panel larger, you can do so by minimizing some of the other panels like chat or Q&A. And conversely, if you do not need the captions, you can go ahead and minimize the Media Viewer panel. We will have some time at the end of the webinar for questions. Please use the chat box or the Q&A box to send any questions that you may have during the course of the webinar to me, Nakia Matthews, or to Michael Rausch, our moderator, and we will direct those questions accordingly during the Q&A portion. If you are listening by phone and not logged into the web platform, you may also ask questions by emailing them to Michael directly at mrausch@ndi-inc.org. Please note that this webinar is being recorded and that the materials will be placed on the NDI website at www.realeconomicimpact.org. And finally, if you experience any technical difficulties during the webinar, please use the chat box to send me a message, or you may also email me at nmatthews@ndi-inc.org. And with that, I'm going to turn it back over to Michael.
Great. Thank you, Nakia. So for those of you who are not familiar with the National Disability Institute, I would like to share a little bit of information with you. So the National Disability Institute, we are a national research and development organization with the mission to promote income preservation and asset development for persons with disabilities and to build a better economic future for Americans with disabilities. At the National Disability Institute, one of our programs here is the Real Economic Impact Network. And the Real Economic Impact Network is an alliance of organizations and individuals dedicated to advancing the economic empowerment of people with disabilities. The network consists of more than 4,500 members located throughout the United States. Our members include nonprofits, community tax coalitions, asset development organizations, financial education initiatives, corporations and private sector businesses, federal, state, local governments, and agencies, as well as individuals and their families with disabilities. All partners of the Real Economic Impact Network are joining forces to embrace, promote, and pursue and access inclusion of people with disabilities in the economic mainstream. To learn more about the Real Economic Impact Network, please go to our website at www.realeconomicimpact.org. And you can sign up on our website, and it's free to join the Real Economic Impact Network. So today I'm joined by two of my colleagues who are part of National Disability Institute's Training and Technical Assistance team. Today they're going to share information with us on a new innovative program at the National Disability Institute called the American Dream Employment Network. With that, I would like to turn it over to our first presenter, who is Mary Lynn Revar, who is a co-director of the American Dream Employment Network. Mary Lynn?
Thank you, Michael. And can you just confirm you can hear me okay?
Yep, you're good.
All right, thanks. And welcome, everyone. We're so pleased that you were able to take time from your busy schedule and join us today. We are going to go ahead and get started and move to the slide that talks about the agenda. What we're hoping to cover today during our visit with you is describing the current landscape of the disability community and employment culture. We're going to talk about Ticket to Work. We are going to introduce to you the American Dream Employment Network, and then get into a little bit more of a detail is if you would have interest of joining our American Dream Employment Network. We'll give you some specifics on how to take some steps to do that. In regards to the current landscape, there are a lot of activities happening across the country, many of them at the federal level, and as a relationship to that, some state activity. We thought we would just review those, even though many of you on the call today are probably familiar with these, so we're not going to get into great detail, but just highlight, some of the components of these different policies and laws and movements that are trending across our country. First and foremost, Employment First, which is designed to really encourage that employment is the first option for individuals with disabilities who are leaving the the youth transition, leaving the educational world and moving into adulthood, as well as those who obtain a disability in any point of their lifetime. The Olmstead Act, which has been around for many years, however, because of some of the expectations in that act and requirements, there has been kind of a flurry of different legal activity occurring in multiple states, which has resulted in some decrees that have been noted for states to have to respond to and take action, and often related to providing the opportunity to have employment in a variety of different settings, including those that are integrated and competitive and not isolated. In 2014, the National Governors Association noted in their national agenda that there was a recognition that employment for people with disabilities should be a high priority, and this has resulted in numerous states having a directive from their respective governor. The Centers for Medicaid and Medicaid Services across the country, who oversee the Home and Community-Based Medicaid Waiver Program, they also have made some policy changes in regards to shifting the focus on competitive and integrated employment. And the last policy that's stated there was the implementation and passage of the Workforce Innovation Opportunity Act, which occurred in 2014. And this is under the Department of Labor, which, again, for the first time has really highlighted the activity and the engagement of job seekers with disabilities. In addition to all of that activity, there was also in 2014 an expanded compliance expectation placed on Section 503 of the Rehabilitation Act. And what that pertains to are federal contractors and subcontractors, the expectations and the compliance requirements that they have to prohibit any kind of discrimination against applicants and employees who have a disability, and looking at how they can recruit and employ and advance individuals with disabilities within their workforce. The subminimum wage law, which is addressed under the Department of Labor, looks at circumstances of when And if sub-minimum wage is allowed, and the expectation is the expectation that all people, including individuals with disabilities, would be offered minimum wage. The federal, at the federal level, employees are all will be given or they are employed at the federal minimum wage level. And again, that's just another indication that at the federal government level, they are setting the stage of the expectation that everyone, including those with disabilities, would be employed at the minimum wage, and their minimum wage level was increased. That leads us to talking about what are some disturbing facts in the landscape of the disability community. There was various research that was occurred in regards to looking at the financial status of individuals with disabilities. There's a couple of those highlighted on this slide. The first one being from a document titled The Banking Status and Financial Barriers of Adults with Disabilities, Findings from the FDIC National Survey of Unbanked and Underbanked Households. What was found in this research is among households headed by working age persons with disabilities, nearly 1/5 were unbanked and more than 1/4 were underbanked. This coupled with some additional research that was highlighted from the financial capability of adults with disabilities, findings from the FINRA Investors Education Foundation in 2013 Financial Capability Study, that 81% of people with disabilities did not have an emergency fund to cover 3 months of expenses, while 70% said they could not come up with $2,000 in an emergency. 82% of people with disabilities have not determined their retirement savings needs. All of these factors that we're pointing out in this particular slide is very disturbing, and I think it's evident that we really need to help not only encourage different strategies to help individuals with disabilities excel and elevate their financial status and their financial health, but we probably need to be starting with an awareness of where it's at and how to move forward. The information that we just shared really supplements earlier research and findings that we have known for a number of years. Nearly 1 in 3 people with disabilities live in poverty. And that poverty rate for people with disabilities is nearly double of the U.S. national poverty rate. It stands at 28.4%. 40% of individuals who are receiving the Social Security Administration disability benefits want to work, yet less than 0.5% ever get off of benefits. So we have some common barriers that have been identified of what's contributing to some of these issues, and especially related to employment. It may be that it's lack of access to reliable, trusted, and quality employment services. I believe all of us on the call today would agree that for any of us to go out and get a job, sometimes we need the assistance and support of others to help us. And this certainly is not the case for everyone with a disability, but does seem to be a common barrier. And within that, we feel that there are some specific points that we all need to recognize. First and foremost is if you're on Social Security disability benefits, it is not easy to understand what is going to be the implication if you are going to become employed and start having wages. There is a level of expertise and training that's available to help address that particular subject. It's called work incentive counseling, and there's benefits planning services along with that. That is a very high-level area of expertise and really needs to be conducted by certified personnel. We also know in order to provide quality employment support to an individual, it's best to be able to do that by face-to-face services. Granted, with the technology that we have today, there certainly is means and success at using technology from a long-distance relationship, but really for excellent services, it's recommended that an individual can have face-to-face quality customer services. And the last point we wanted to share in regards to quality employment services and supports is often what we hear, and I say we, I meant my colleague Kevin Nickerson and I'm sure many of you on the phone today, that if an individual is on Social Security benefits, they've gone through some pretty tough times. There's a reason why they're eligible for the benefits. But what small contribution that I think we can give to these individuals is providing them hope that they can move forward and at least attempt to see if employment could be a strategy to help them build their financial health. We want to kind of narrow our numbers down a little bit here and give you some statistics in regards to who are Social Security Administration disability beneficiaries. Well, Social Security reports there are approximately 14.5 million Americans receiving either SSDI, Social Security Disability Insurance, or SSI, Supplemental Security Income. And for some individuals, they receive both, but 14.5 million Americans. Social Security's Ticket to Work program is a strategy. It's a program that they offer as a potential roadmap to help individuals seek and maintain employment, and hopefully through that goal of obtaining a more self-sufficient lifestyle and becoming less dependent on the Social Security benefits, that they can begin to have a path out of poverty. Who provides the services under the Ticket to Work program? Well, there are basically two types of service providers. The state vocational rehabilitation agencies are a provider, as well as employment networks, which we often refer to as ENs. And employment networks exist throughout the country, and they are designed to offer employment services through the Ticket to Work program. With that, I'm going to turn it over to Kevin to speak a little bit more specifically about the Ticket to Work program.
Thanks, Mary Lynn, and thanks, folks, for joining us. I had this random thought while I was waiting to speak here that my guess and assumption is that the folks that we're talking to today are not federal employees. Otherwise, they would be off doing their own thing with their day off. So we appreciate your attendance today. And we didn't want to assume that people had the backdrop for what the ticket program is all about. So we're going to talk a little bit about this and what this is all about. And this was established, the Ticket to Work program, through legislation in December 1999 through the Ticket to Work and Work Incentives Improvement Act. Out of that came a lot of improvements. Primarily, and what we'll focus on today, though, is the Ticket to Work and Self-Sufficiency program. So who's eligible? Well, anybody who receives Social Security disability benefits of working age. So that's either SSI, Supplemental Security Income, or SSDI, Social Security Disability Insurance benefits. Again, 18 to 64. And folks would need to be in cash payment status to be eligible. There are certain goals of the ticket program. The first and foremost, which I admire a lot about this statute, is choice. This does offer beneficiaries expanded opportunities, a new universe of providers, I guess, for them to choose and receive employment services and supports. Additional goals are financial independence and self-sufficiency. I mean, I think really the bottom line of the ticket program is just that. It's the goal of every employment network to help people achieve that through employment. And Social Security, of course, wants ENs to help people reduce and when possible, eliminate completely their reliance on disability benefits. Yes, that can mean termination, and I know that sounds scary, but this is certainly a planned event if we're working with folks. So from the perspective of the beneficiary, again, I think the primary point to bring to the table is that choice is what matters here with ticket. It's up to the person if they decide they want to work through the ticket program or if they're ready to work. Basically, the ticket program is for people who are ready, willing, and able to try returning to work again. And Mary Lynn pointed out that, you know, it's an opportunity. I mean, it may work, it may not. Sometimes the only way to figure that out is to try. Folks can also decide what employment network they want to work with. So when we think about this, prior to the ticket program, there really wasn't a choice. There was state VR, which of course we need, and it continues to be an extremely important service for folks. But, you know, there really wasn't another choice for folks that didn't maybe need that level of service from state vocational rehabilitation. And now there is through the ticket program, through the variety of employment networks that exist. Also, for folks that have this option, they can unassign the ticket at any time if they're not happy with the service they're receiving from an employment network. Now that might seem scary to an employment network. I actually like these options of choice. I think it really what it does is it increases the bar and the need for exemplary customer service that we provide people through our employment network operation. Folks often wonder if there's a risk in assigning their ticket, and there is really limited risk or no risk in assigning a ticket. There's no cost to assign the ticket. It's available as soon as somebody is eligible for benefits, cash benefits, and although they don't get an actual ticket like they used to, in the past they used to mail an actual piece of paper that looked like a ticket to work, and now they just inform them in a mailing. Assigning a ticket doesn't affect somebody's benefits or health insurance. What it really does is offer them services. And I think that is the primary benefit. Last and not least, there are additional benefits of assigning a ticket. And again, I think the primary motivator for folks that do assign their ticket should be the kinds of services they'll receive from an employment network, which is why folks should shop around, frankly, before they choose an employment network. Otherwise, if they don't know what their options are, they haven't really exercised choice. So we really encourage folks to look around and figure out the offering of each employment network before they make a decision. Another benefit to assigning a ticket, I wouldn't say this is the most powerful benefit. I, again, think that the services people receive are the most critical benefit, but people do have the option when they assign a ticket to not have any more medical, well, it's not an option, it's an opportunity, to not have any more medical continuing disability reviews while their ticket is assigned, and that person is making progress in the program. And there's specifics about what that means to make timely progress that we won't get into the weeds about today. But this is another advantage, and sometimes this is a concern of folks, depending on the kind of condition that they have. So how does state vocational rehabilitation fit with the Ticket to Work program? What's their role? Well, I always like to think of it this way. A ticket can only have one home. So if a beneficiary is being served by VR, and when we say served by VR and they have an open case means they have a plan with the vocational rehabilitation system, and they would have signed off on that. That means their ticket is in use with the vocational rehabilitation system, and that means at that time they cannot assign their ticket to another employment network. Now, it's typical that after VR places somebody, they will keep the case open for 90 days to stabilize employment or to make sure employment is stabilized, after which they will close the case. After VR closes the case, the person does then have the opportunity to assign their ticket again to an employment network of their choice for ongoing support. At this time, there is a 90-day window. At the time of case closure, there's a 90-day window that opens for people to reassign and to keep their medical protections that I talked about in the previous slide. So this is a great advantage. It's also the bigger advantage, again, I think, is to get continued services. I mean, we know that people are far more likely to be successful if they continue to be supported after a VR closure. So this is a good move for the individual primarily, and for our state VR systems, so that people are supported after case closure. And of course, it's good for ENs because it offers them opportunity to work with folks. it is not required, and this is something that we get questioned on a lot. So people don't have to use VR services first. In fact, sometimes people don't need VR services. This is what we talked about earlier, that ENs offer a new choice. So maybe it is that somebody doesn't need the level of service that VR offers, and an EN service is completely appropriate. They can go directly to an employment network and not ever go to VR if that's appropriate. I will put a note out to you, though, that the VR system and employment networks both have employment outcomes that they have to achieve with folks, and so again, it could be that somebody goes right to an EN. It could be they go to through the state VR system, then they're closed and they come to an EN. There's lots of choices here. So let's look at the role of the employment network. First of all, ENs do have to have the requisite skills to be involved through the Ticket to Work program and to hold a contract. So they basically have to have experience providing employment services to disability beneficiaries. Not only that, they have to have a certain number of years of experience, and it has to be recent experience. So the bottom line, I think the second bullet here that we talk about is really a good summarization of what an EN has to do. They have to do everything they can to help beneficiaries reduce and hopefully eliminate dependence on benefits, thereby increasing the financial stability of the folks that they serve. I mean, that really is the best way for us to summarize the EN role. Now, there's, of course, a lot that goes into this. It sounds simple, but it certainly is not. And we've never said it's easy work, but it's certainly work that we're glad to be involved with. But this requires a lot of planning and often the use of some of the work incentives that Mary Lynn mentioned earlier that are fairly complex. So in terms of who these ENs are and who they represent, there's a wide variety of agencies involved as employment networks. I've given you some examples. It's certainly not an inclusive list, but these are typical providers that you would see in the mix, and that could be, community employment service providers. It could be the public workforce system. It certainly includes the Centers for Independent Living and many others. Another example might even be LLCs, individuals who are doing business on their own and have that requisite experience. In terms of the services that ENs provide, well, it's very specified in the contract that ENs have what services they need to offer beneficiaries or who we'll call ticket holders. And at a minimum, the services that employment networks need to provide are these three that we have highlighted here: career counseling, job placement supports if the person is not working at the time of assignment, and long-term follow-up supports. And as far as long-term follow-up supports go, that's really a big advantage of EN services because we talked about how typically, VR will close a case after 90 days. Well, an EN can work with someone for up to 7 years or so. And that varies depending on the benefit that the person receives. But we can work with folks for a very long time and make sure everything is going smoothly and that this transition from benefits to self-sufficiency is successful. Currently, there's about 500 ENs in the country. That's a rough figure. There might be more or less than that at this time. And, that's a small number of providers relative to the great need that there is in this country. If you want to look and find who those providers are, we've given you a listing here and a link that takes you to the provider directory, the EN directory, and from there you can find out who the ENs are in your area. So why is the involvement in the ticket program so limited? Why are providers not involved in this? I mean, this program has been around since 1999, and I think we've identified some of the challenges, and there are a few. It's difficult to become an EN. The RFQ alone, the document you have to pour through to apply to become an EN, is over 90 pages. After that's been dealt with, though, then it's a lengthy contractual process. You also have to develop a very specific business plan about how you will provide services. I think that's smart, but these are all pieces that are required for you to become an EN. There's also, after you get beyond that process, the challenge in operation. And the thing we hear the most across the country is this administrative burden that is placed on employment networks, and the lack of staff capacity to fill in the gaps here. In fact, I'm on a number of committees, some of which have reported through some studies that up to 40% of their time is spent on admin duties. So that's very challenging for small and even large agencies. The next items have to do with the development of how do we track all this information. We have to track the people that we've got assigned. We've got to track their employment status and so forth. There's a lot of tracking and reporting requirements that SSA places on folks who have a contract. And beyond that, there's this intersection of Social Security work incentives and the complexity of how Social Security disability system works and how to help people move from benefits to self-sufficiency. So that whole process in and of itself can be fairly challenging. And we understand that we do have WIPA services nationally. That's the Work Incentive Planning Assistance Project. But even though we have that to provide guidance to folks, it's a very limited resource. So there are all these challenges, and I'd like to think that we've come up with maybe a solution to at least some of the difficulties that ENs have faced over the years. And with that, I'm going to turn back to Mary Lynn to give us an introduction to the American Dream Employment Network.
Kevin, I think during our call here today, we've tried to point out to you the large picture of what is that current landscape. How many beneficiaries are there out there, and how does the fact of trying to live on this receipt of benefits impacts their financial situation, and through employment, could an individual, again, move forward and be a little healthier in regards to their financial condition. And it was about a year and a half ago where Kevin and I were talking one day, and we've been working together for many, many years and have a pretty extensive history with the ticket program. And we decided, boy, what we hear is these common barriers over and over again. Is there some way that we could address those through the level of expertise that we have and familiarity with the ticket program, and tap into some of these fantastic resources that are already out there? We also have heard from many service providers that we provided technical assistance to across the country. Well, we'd like to be engaged with the ticket program, but we just really need help to do that. And we really don't want to, as Kevin mentioned, take on that administrative burden. So we put our heads together and we came up with what we feel kind of our American dream. And we titled a new employment network called the American Dream Employment Network. For short, we refer to it as ADEN. Well, what is ADEN, who we are, how is it designed? ADEN represents a consortium of agencies across the country providing employment services and support to everyone who participates. We are a division of the National Disability Institute, and it is our mission at ADEN that is identical to the mission of NDI to provide a better economic future for Americans with disabilities. We are interested in providing services that lead to long-term financial stability of each participant. And we're going to describe what a participant is in just a minute. We also value the contributions that Americans with disabilities can bring to the workforce. And we recognize that for a business that draws upon a diverse workforce, including those with a disability, are our strong businesses. We have businesses out there who are recognizing that this is a really good strategy, and they're reaping the benefits of that. The key stakeholders as we designed this employment network includes 3 key players, participants. And we want to point out, why are we using this word participants? Again, it kind of has to go with the history that we have seen over the years of the ticket program. When an individual decides that they want to seek employment, if they're on benefits, and they are going to choose to work with VR or select an employment network, You know, they are expected to, with that support, whoever they're working with, they're expected to put together a roadmap, what they call an individual work plan, to kind of route out what are going to be the action steps to seek that employment and maintain it, and hopefully move it to a level where they would become less dependent on the Social Security disability benefits and become more self-sufficient. We felt it was really important that the individuals who choose to work with ADEN, we wanted them to feel like they are the director of this plan, and they need to be actively engaged and participate. And therefore, we have chosen the word participants as a reference to those individuals on benefits between the age of 18 and 64, as Kevin mentioned, who are indicating that they are going to be active and they voluntarily want to participate to secure employment, leading to self-sufficiency, and have chosen to work on that goal with ADEN. So again, we don't refer to them as beneficiaries, we refer to them as participants. The second key stakeholder are members. Members represent these employment providers across the country who are providing the direct service of employment services and support, assisting the individuals, these participants, to improve their financial stability. The third key stakeholder are employer partners. We felt it was very important that we include in our business design employers. That is really another half of the equation. If we got to marry the supply and the demand. And if we're working with participants who want to seek employment and they've got the support of these members, we really need an employer to hire them. So through a memorandum of agreement, which lists some terms in which an employer would agree with us, these employers become partners with ADEN. And they represent employers who have an interest in hiring and retaining qualified individuals with disabilities. The core services of ADEN are basically 5. And you're going to recognize 3 of these because Kevin mentioned them in a previous slide. The 3 that are required of all employment networks under the agreement that is contractual with Social Security are career counseling, the job placement service, and long-term employment supports. But what makes ADEN, we feel, different is our robust investment, training, and technical assistance around 2 additional services. 1, benefits planning and work incentive counseling or advisement, and the second one being financial wellness, and that includes providing participants information and resources and tools that really help them become more educated and informed of how they can become knowledgeable about their financial situation and how to address any concerns that they have. It also includes a financial health assessment. And that's like a snapshot looking today, what is their current situation, and again, identifying if there are some areas that need to be addressed and what are some resources either locally or nationally that they can take advantage of. Our engagement with employer partners, as I mentioned earlier, is really an opportunity that we feel in a more formal way to get that connection between the participant through the assistance of the member with an employer who's looking for a particular skill set in which that individual, that participant, has the qualifications to meet the expectations that an employer has. ADEN employer partners include not only businesses that desire to diversify their workforce and understand that individuals with disabilities represent a large talent pool, but it also includes businesses who, as I mentioned earlier, need to be compliant under the Section 503 of the Rehab Act. So those are the federal contractors and subcontractors. If they have a contract that's greater than $50,000 and employ more than 50 people, then they need to have a number of different elements in place with their business operations, specifically for their recruitment and hiring, where within their affirmative action plan, they need to be able to demonstrate these are the steps we are taking to reach out and conduct activity in different communities, specifically the disability community, to let them know we welcome applicants who have a disability. It also, in Section 503, has really opened the door to increase the comfort level for individuals who are currently employed to disclose they have a disability. We all know across our country, we hear it over and over again that there's a shortage of skilled workers, and we recognize that individuals with disabilities, they need to have the same skill sets that others are expected and employers are looking for. And therefore, even though this is an untapped pool, we will really strive to work with our employer partners to identify what are the skills that they are needing so they can build their future workforce. I alluded to the fact that these employer partners, it is more of a formal relationship, and therefore they do have a memorandum of agreement with us that outlines that working relationship. And I already referenced that this is a proactive option for federal contractors because, again, their expectation in order to be compliant needs to demonstrate they are conducting active recruitment of people with disabilities. So if we have an employer who has a relationship with us, that could be one example of their evidence of what they're trying to do in their efforts to recruit individuals with disabilities. We're going to move to a little bit more of a specific guidance with Kevin sharing with you. If you think you're in a position, if you are an employment service provider on the call today, and you have an interest to learn more, where would you get information about ADEN and what would be the benefits or reasons why you might want to consider joining our effort, Kevin's going to share with you that information.
Thanks, Mary Lynn. Okay, let's talk a little bit about membership, and well, I'll give you some more information about ADEN and our current situation. Today, at present, we have 19 ADEN members, and I'm going to talk a little bit on a slide or two here coming up about Mary Lynn and I's specific experience. But let's say we're not new to the ticket program. We've both been engaged in this since its inception. But this model is something we've been working on for not even quite the last year, so we're pretty pleased that at this time we have 19 members. And they're located in 9 states across the country, as you can see in the map here. Our membership continues to grow. We're pleased about that. And we are continuing to expand locations monthly. We are looking for new members, and that's why we're talking about membership now. And we're especially interested in filling in the map, as you can see here. And you can see we've really focused on the East Coast, and we have some Midwest members, which is great. We don't have a lot of presence yet on the West Coast. So if you're someone out there listening and are on the West Coast and you like what you're hearing today, we want to hear from you today after the call. And here's some reasons we wanted to give you to consider ADEN membership. We talked about the complexity of ticket and becoming an EN, and I think that's pretty well documented. I think we would see many, many more providers involved if it was not, unfortunately. But we've given you some items here that we think make it easier for providers like yourselves that are listening today to become part of the ticket program through ADEN. We are the EN of record, and so there's no need to file an RFQ that we talked about to become an EN. You operate under the blanket umbrella or under the umbrella of the ADEN contract, so you don't have to do that. You can begin assigning tickets right away after you become a member. I mean, we say immediately, and I think when you think about the time it takes if you were to do this yourself and become an EN, I think you'd be lucky to assign tickets within a year. When I say immediately, what I'd like folks to understand is we want people to complete our core training before they assign tickets, but that doesn't take long. So it's right away after becoming a member that folks can start assigning tickets. You don't have to communicate with SSA as one of our members. ADEN administration does that, and we also manage billing and distribution of a ticket revenue to members in a timely fashion. So you don't have to bill, you don't have to communicate with SSA. We do all that for you as part of the administrative function that we offer. So in essence, what we're doing is we're freeing our members of those admin duties that we talked about earlier. Although there are some data entry responsibilities, they're quite minimal. And by comparison, the time you would spend in those responsibilities versus if you were doing this on your own as an EN is just extraordinarily different. You might wonder, if you're an EN already and you're listening to this, would an EN join? And the answer is yes. We do have a number of existing and experienced ENs that have decided to join ADEN. Why? Because they want to take advantage of the administrative duties that we can take care of for them so that they can focus more on serving the folks. You know, I talked before, we've had some reports of ENs that are stating that they're spending up to 40% of their time in admin duties. That's kind of ridiculous when you think about it, and difficult, because that takes away from the time that folks can spend serving customers. So why would an experienced EN join us? Well, because they want to spend more time serving our participants, and frankly, it's an opportunity to expand the number of folks that they serve because they're no longer having to take on those admin duties. Maybe it's presumptuous, I don't think it is, to say that we offer a premier support. I think it's safe to say that, since Mary Lynn and I have combined experience of over 40 years in the disability community and in trying to enhance the services that individuals with disabilities receive. So I think that's a fair statement. We've also both served on specific Social Security teams that look at enhancing and improving the ticket program. They're called Tiger teams. For those that are a little familiar, I can tell you that some of the things I'm most proud of that Mary Lynn and I were able to shift and get moving in the right direction is the automated payments that now are available to folks, and even some of the assignment process were suggestions made while we served on that Tiger team. Mary Lynn has also had direct experience working for the operations support manager for the ticket program, and provided technical assistance to providers in 30-plus states. So we're no stranger to providing TA as well. And I've spent most of my career really focused on Social Security disability benefits and work incentives. I guess you could say I'm a glutton for punishment, but it is complicated, but it's also exciting in some way when you can master these work incentives. And it's also the piece that really provides hope to folks that we serve when we talk to them about things that they've never been told before that exist, opportunities that they didn't know exist, work incentives that can help make this easier for them to return to work. And these are the things that we teach our members. In short, we provide our members practical training and resources that support their work. But we also provide something else that is I think, one of a kind. We have a secure provider portal, or a portal. We call it the ADEN portal. Our members use this to manage all the data that we have to collect in a secure environment. We've made it quite simple for them to use this. It's also going to allow us to capture some fantastic statistics about the work that we do and about the work of each member. So at each member's site, the way our system works, they'll be able to get statistics about how are they doing with the folks they're serving. And then as a collection of agencies, as our consortium of all providers, we can provide data at the end of the year, and of course have to, because we do the reporting for to Social Security, but we can provide then evidence of our work at the end of each year. Of course, our first year's data is going to be kind of skewed because we're just getting started this year, but we're really excited to see these stats in the years to come. From the business point of view, if you're wondering, well, you know, how's this going to work for us? Well, and you should think about it this way. I think one thing about the ticket program that I love is it's very entrepreneurial. And in our field, it's not typical that we have to put that business cap on, but with the ticket program, you really do. And one of the things we want you to think through today is that if you join us, this offers an opportunity for you to access new customers and a new referral source. We can help you build your customer base from the thousands, typically thousands of beneficiaries that might exist in your community. Additionally, you may already be working with folks in your own organization that are working and ticket eligible right now. We can help you identify those folks. There's a way that we can do that if folks do engage us. We can help you sort out the number of tickets issued in your state, and also not only the number of tickets issued, but the number of tickets that are assigned versus those that are not assigned. So we can really dig into the numbers with you and look at your area specifically. One of the other things that we can offer is this continuity if a staff member leaves. This is often a big deterrent for agencies, or a stumbling block for agencies, because there's usually one person that really gets it. You know, they've gone through all this training, they've spent years doing this work, and they leave. And that's often when we see shop closes up for ticket. It's so unfortunate. One of the things we could do is keep our members moving along and help to train that new person that they bring in, because staffing will change over time, and we know that. And we also knew this would be a big benefit to the member sites that we serve currently, that we can be there to help train that new person and kind of carry on their caseload in that interim while they find that person they're looking to hire. This certainly avoids any shutdowns or any gaps in service, and it really allows our participants to feel like they're completely supported through this process. Mary Lynn spelled out nicely that the other thing that we do is help to make connections to employer partners. Now, we're really going to ramp this up in the year to come, but we're obviously, again, Mary Lynn covered this. We're really going to focus on probably larger employers and employers that have some skin in the game. I mean, they really, when I say that, I'm talking about federal contractors that have to comply with Section 503 and hopefully that have a real desire to diversify their workforce, not because they have to, but because they know that there's talent out there that they're not tapping into. Those are the employers we really want to engage. Well, what's in it for me, you might ask, and how does revenue work? Well, it's very simple. We only achieve payments when we achieve certain milestones or outcomes with folks that we serve. When we do, when that member site does achieve that outcome with a customer or a participant, they get 80% of the payments. It's that simple. And this split that we came up with, 80-20, was even recommended by Social Security, so this is a recommended split. We certainly encourage the use of this money to support the ADEN point of contact, the person that's going to be doing the work day to day at each agency. You might ask, well, what about this revenue, though, in terms of other things that we're up to? Is this going to conflict with other income or program dollars that we have, because we don't need that? Another way to put it is ticket revenue double dipping? Well, we have a couple of clarifications from some important departments here, federal departments. One is USDOL, who's already told us that EN payments are not considered program income for the public workforce system. So it's flexible income, which is very unusual in our field to have that kind of flexible revenue. We've also gotten a statement from CMS that states that EN payments don't conflict with folks who are getting Medicaid-funded services. So no, it's not double dipping. You can continue to do what you do with those other funding streams and work through the ticket program. And again, the remaining 20% would cover admin fees and our support, which covers technical assistance, training, the portal, and ongoing tools that we provide our members. We wanted to share with you some comments we've already started receiving from our members. It's very flattering to us. We're very pleased that they also were willing to share these statements with you, our audience, today. And I'm not going to read them, but I'm just going to leave that up there for a minute for you to look at. But we're just blown away with the membership that we have currently. And we're looking, you know, we do vet our members carefully. We want folks that have that experience that's required. If you're not sure, or you think that maybe you do, maybe you don't have that experience, that's, you know, I'm going to show you how you can connect with us on this next slide, and we can take next steps and have a discussion about that. But we really want to thank those members that allowed us to use their comments. And they had no idea we were collecting these, but, you know, when somebody sends something to you that's positive like that, well, you know, sometimes you save that, and it came into play today. We really appreciate those comments. So if you're interested in learning more, if you like what you heard today and you want to know more, and I'm sure there's lots of questions that were not addressed today, you can certainly first visit our website. And there it is right there on item number 1. That's www.americandreamen.org. Next, after reviewing our site, email us, and I'm going to give you that information on the next slide, and we can give you additional information and materials that we wouldn't provide folks until we're really moving along with them in next steps in the process. Things such as our agreement that we would want you to review prior to a call with you. If you're a participant that wants services and you're listening today, well, that's a very simple process too. We have a toll-free line we have listed. It's 844-687-2336. We'd love to hear from you, and we can evaluate if we're a good fit for services that you need. If you are, we refer you to one of our member sites of service. With that, I'm going to turn to our contact information and leave it there and pass this back to Michael Rausch to see if there might be any questions from our audience today. Michael?
For providing this information with us. So we have 5 minutes left, and we are always trying to make sure we get done right at time. We have several questions, so we're only going to be able to get through a few of them, and so we're going to do kind of a speed round just to make sure that we have a chance to talk about next month's webinar as well. The first question that came in was, Mary Lynn, I believe it was you who was talking about some of the statistics earlier. Can you define unbanked and underbanked?
Sure. Thanks, Michael. Sorry, we had a little bit of a goof up getting me off mute. Unbanked means that you do not have an existing bank account, so you're unbanked. Underbanked would mean that you have an account, but it's either extremely low. You may not really have any activity or a pattern of any activity in that account, and maybe it's only limited to some certain limitations. So if the person who's asking that question would want to get more information, they can certainly email either one of us, and we'll get you connected to the resources.
All right. That was a good answer, Mary Lynn. Great. Okay, the next question is, please give the link to find an employment network again.
Michael, this is Kevin, and that is included in our PowerPoint. If folks are going to access that, I can dig that up and put it in the chat, or in the chat too, if that's more convenient.
All right,
I'll look that up
right
now. Yep, it's ChooseWork. Yep.
ChooseWork. Oh, yep. Okay, great. So that will go in the chat box. Excuse me. The next question is, do you provide WIPA services to ticket holders if we are a member of ADEN? It is a challenge for us to get our compliance meetings with the WIPA providers, so is this an incentive for us?
I'll go ahead and take the first stab at that one and try to do it briefly because of time. In a nutshell, because of the expertise that we have within the administration of ADEN, we provide training in regards to benefits planning and work incentive advisement. We are not able to certify you, but we get you prepared, provide you practical application of those work incentives, and allow you the opportunity to kind of build that confidence and that knowledge so you have the foundation to go into a certification yourself. During those times in which you're not certified, so we have some members who are, we have some members who are not, then we recommend they use their state WIPA project. And we, again, could be a liaison to connect you with that project.
Okay. So I think that what they're really asking is, so the support that you provide, you do not do benefits plans or for an individual, a ticket holder.
Oh, yes,
correct?
we do.
Okay.
We do. And again, I think if that individual, unless it's multiple people, would want to know more about how we do that, we provide tools and training and, again, ongoing technical assistance. We provide some advanced training in that area. So we can talk more offline if you want to have specifics of how we achieve that.
Michael, I'll just add one last little tidbit to that, and Mary Lynn really addressed it well. But the bottom line is this: anybody who we work with, whose ticket we assign, we will develop or make sure they have developed a benefits summary plan that talks about their benefits specifically, their work incentives, and their plan.
Great. All right, perfect. Well, I'd like to thank, we're out of time here, and I'd like to thank Mary Lynn as well as Kevin for providing this information today. If you're not a member of the Real Economic Impact Network, we hope that you will join us, and you can sign up for that at on our website. Please note that an organization can be a member of ADEN and can also be a member of the Real Economic Impact Network and be able to access all of the various free tools that are available. I hope that you will join us on Wednesday, December 2nd at 3 p.m. We are gearing up for tax time, and this is really an important time for us at the National Disability Institute. And so we are going to have CFED's Taxpayer Opportunity Network highlight tools and resources that are available to help taxpayers as well as those organizations offering free tax preparation services in the future. I would also like to make sure that you check us out on the various social media sites, as we provide a lot of great information there as well. Again, I'd like to thank my colleagues, Kevin Nickerson and Mary Lynn Ravar, for sharing information. Also, would like to thank my colleagues, Nakia Matthews, as well as Lori Shaler and Brittany Taylor, and the other staff who are part of NDI's technical assistance team and who help us put all of these webinars together. So with that, we hope that you have a great day, and thanks so much for joining us today.